Good afternoon, everyone. My research question for my presentation is among pregnant adolescents, how does cognitive behavioral therapy, CBT for short, compared to standard support counseling impact depressive symptoms? To start, to explain why I chose this topic, um, this was very personal for me, being that I was a teenage mother and I knew some of the challenges that I faced when I was being a teenage mother. You know, teenage pregnancy can be an important clinical concern of exposure of adolescents in school experience significant mental health challenges. From a personal standpoint, having the experience being a teenage mother, I know firsthand that many teenage mothers experience depressive symptoms that are not treated, which then leads to them struggling with school engagement, being prepared to be a mother, and their emotional well being. Most teen mothers do not recognize the depression because they lack standardized screening and targeted intervention within the school environment. Failure to identify and treat the depression symptoms may lead to long term consequences like poor academic outcomes, chronic depression, impaired parenting, child bonding. It is very important to address the mental health of pregnant adolescents in order to improve both maternal and child outcomes. The hypothesis of this research is pregnant adolescents that participate in cognitive behavioral therapy will be able to experience a reduction in their depressive symptoms compared to who receives a standard supportive counseling only. The theories used in this research are cognitive behavioral theory and ecological system theory. The foundation of the study is cognitive theory, which is the backbone of CBT. It is proposed in cognitive theory that an individual's behavior and emotion is influenced by their beliefs, thoughts, and perceptions. As it relates to this study, where pregnant adolescents experience patterns of negative thoughts and feelings like shame, fear, embarrassment, and hopelessness, which contribute to them having depressive symptoms, being able to identify and reconstruct individuals' maladaptive thoughts can develop better coping strategies and improve their emotional well being. This highlights the relevance of using CBT for pregnant adolescents that are trying to get through hard life stressors and stigma that affects their mental health and well being. Another theory that influences study is ecological system theory, which emphasizes that individuals are influenced by different environmental systems like school, their family, their community, and peers. As it relates to pregnant teens, these systems influence the mental health outcomes. Being able to integrate both CBT and EST within the study highlights the influence of both internal cognitive processes and environmental influences. EST helps with building trusting relationships between teens where they don't think it is all their fault what they're experiencing, but rather identifying environmental factors that contribute to their problem. The methodology. During this study, quantitative research method will be utilized to be able to analyze how effective cognitive behavioral therapy will be in reducing the depressive symptoms that are experienced by pregnant adolescents. A quasi experimental design will be used, and a pre-test and post-test comparison group design will be feasible for school-based settings. The design will help with identifying the impact of the intervention. The participants will be divided into two groups. One will be the intervention group that will be receiving cognitive behavioral therapy, and the other group will be the comparison group that will be receiving the standard supportive counseling. Both groups of participants will be assessed twice, which is a post test, which is a baseline before the intervention, and the the pre-test, which is a baseline before the intervention, and then the post-test, which is after the 8 weeks intervention period. Data will be collected using the Patient Health Questionnaire 9, PHQ-9. This is a valid way of measuring depressive symptoms that adolescents may experience. This will be administered during both pre-test and post-test to be able to see the changes in the severity of the symptoms. The data will be assessed using statistic methods like paired sample T tests that will evaluate the changes in the depressive symptoms of the participants in each group, independent sample T-tests that will compare the differences between the group that receives CBT and the comparison group, and standard deviation to be able to summarize participants' characteristics. Utilizing the method of analysis will help with better understanding whether CBT statistically causes significant improvements in adolescent mothers with depressive symptoms compared to standard counseling. To be able to know the effectiveness of the intervention, it will be measured by the reduction in PHQ-9 scores from pre-test to post-test. Reports of indicators of improvement in the participants' school engagement or even self-report of coping skills that will be acquired. The sample frame is pregnant adolescents aging from between 13 and 19 enrolled in the selected high schools that were referred by either their school social worker, counselors, or teachers. The criteria is another criteria is they have to be either pregnant or already an adolescent parent, showing signs of depression. The procedure of this research is that participants will be recruited from 3 high schools in the city of Syracuse in the state of New York. They will be referred by their school social workers, counselors, or teacher by identifying students that are eligible. The eligibility of the participants are based on whether the participants fall within the age range 13 and 19 years, currently pregnant or already a mother, and experiencing depressive symptoms, mild to moderate level. Parental consent is required and consent from the participants before study begins. Participants will be assessed using the pre-test PHQ-9 questionnaire before starting the intervention to be able to establish the level of depression initially. During this phase, the demographic information will be collected. Participants will then be assigned to one of the groups. This will also be based on the number of eligible participants. During the intervention phase, the CBT group will participate in a weekly session over a period of 8 weeks where they will focus on identifying the participants' negative thought patterns, developing coping and problem-solving skills, and cognitive reconstructing. The comparison group will receive standard counseling over the 8-week period and focus on emotional support and general counseling without CBT techniques. After the intervention, the participants will conclude the study with a post-test using PHQ-9 questionnaires questionnaire to assess the changes in their depressive symptom. The data collected will be entered statistically using a software program and analyzed using methods described previously. The software program that will be utilized would be Statistic Package for the Social Sciences, SPSS. This will be an easy way to analyze statistics from the intervention use. This research will be able to help social workers gain insight on helping adolescent mothers and children to have better outcomes, increase early intervention, and develop better interventions for future pregnant adolescents. Measurements that will be used in this research are pre-test and post-test assessment, PHQ questionnaires, paired sample t-tests, and independent sample t-tests, statistic package for social sciences software program. There were limitations that were identified that could affect the proposed study. A limitation that was identified were the use of non-probability purposeful sample method. This may reduce the generalizable of the findings, being that the recruitment of participants is from selected high school, means that sample will not represent all pregnant adolescents if they are already dropped out of school or does not attend the school selected. Another limitation is in regard to the quasi-experimental design, where participants will not be assigned randomly to groups, so there is a greater risk of threats of internal validity, which leads to bias. There might be a difference between the participants in the CBT group and the supportive group counseling in ways that might influence the outcome also. This study relies heavily on self-reported data using the PHQ-9 questionnaire, which may lead to responses that are biased or inaccurate. The adolescents may not be truthful about the severity of their symptoms due to risk of stigma or fear of being judged. These are my references for my research, and this is the end of my presentation, and I hope you enjoy. Thank you so much.